and is really focused on SMEs, innovators, entrepreneurs in the Southwest region, in Cornwall. But I know there are people outside Cornwall joining us today, which is great to see as well. So there will be a pop-up just now for you around allowing the meeting to be recorded if you just click that. So as I say, we've got a very busy, fun-packed session for you this morning. So I will introduce and hand over to Hayley McBain and Sarah to get us cracking. But before I do that, I just wanted to take a few seconds to do a little quick poll to get a real sense of what you're doing in terms of the work that you're hoping to do. We picked up a little bit in the last session that there's a range of innovators at the moment that want to look at scale and spread at different levels. It'd be great if you can just let us know in the poll that I think Zoe's going to pop up now. Is it, Zoe? How far is your enterprise looking to spread? So is it very locally in the context of just part of Cornwall or in a small community? Or are you looking for national or regional spread? And dare I say, are you even considering global world domination as well? So let us know what you're wanting to do. So you can just click one of them. So I'm going to click 2 because it's there for me as well. The second question was in the context of evaluation. So really getting a sense from you how many of you are considering or have undertaken evaluations. So do you want to, Sarah, if you just move to
it won't let me move on.
Oh, we've got to
I'm just going to end the poll now from the first question.
So we ended the poll for the first one. Brilliant.
Okay, I'll share the results now.
Go on, share the results of the first question. Oh, look at that. Wow, got quite a lot of people thinking globally. Fair few of you, 41% of the people present here looking at national adoption. That's fantastic. That's really useful. And it just gives us a sense of scale here at the AHSN. This is part of a longer term program we're going to be doing with the Smartline Project team. We're led by University of Exeter and partners, and we're going to be running a boot camp and program to support you thinking about scales. So that was really helpful. I think there's a second question as well.
There is. I'm just having a bit of a problem with my PowerPoint.
That's okay. That's all right.
Can you see that one?
Yeah, I can see that.
It works better if I don't do it in.
Oh, okay, no problem.
Okay.
Zoe, do you want to run the second question, which is, do you already evaluate your products and services? So are you already undertaking an evaluation? And this just gives us a bit of a sense of what people are up to at the moment.
That one isn't sharing.
Is it not, Zoe?
No.
Oh, that's okay.
At the end.
Put it in the chat, maybe.
We'll put it in the chat. So let us know.
We'll put it in the chat. Yeah, if you just type your answers in the chat, and then we can record them.
That'll be lovely. Always a few technical things, isn't there, these things? So if you just let us know if you are, yes and yes. We've got a few people, just to give the team a flavour of how knowledgeable you may or may not be around evaluation, and to give us a sense of what you're doing. We'll have a breakout in a minute, which will give you an opportunity to go into that a bit more depth. So I'm going to hand you over now to the brilliant team, Hayley McBain, Dr. Hayley McBain and Dr. Sarah Robbins. And the AHSN does a lot of work around evaluating and spreading technologies, service interventions. So I've had a lot of real practical experience and knowledge about how to support organisations that are looking to scale, whether or not it's locally, regionally, or even nationally and globally. And Hayley and Sarah, we're really lucky to have them in our team, and they lead a program of work which is to really engage and support innovators. And I've worked with many innovators and technology organisations over many years, and have a real experience, particularly around implementation. So looking to really scale something, what do you need to really consider? So to start us off, Hayley is going to take us through a bit of an overview of evaluation and what we mean, and then Sarah's going to pick up a little bit around the spread and adoption piece of evaluation, particularly building on the last presentation that we did around spreading and scale. So over to you, Hayley, to take us through the first section and to introduce yourself.
Hi everyone, can you hear me okay? Yep, okay, good. My name is Hayley McBain. I'm one of the evaluation leads at the Southwest AHSN. And I'm just going to be giving you a brief overview of what evaluation is, what it might look like, and then Sarah's going to take that forward later and talk about it specifically in relation to spread. So basically, evaluation is a systematic way of understanding what an innovation, your program, your enterprise, your intervention, however you describe what you're delivering does and how well it does it. So that might seem quite complex and maybe a little bit intimidating, but it doesn't need to be. Evaluation doesn't have to be complicated. What the main point to bear in mind is that all you're doing is trying to find out if what you're aiming for is actually happening in practice, or is it likely to happen. If we move on to the next slide. So why bother? It seems quite complicated and intimidating. So why on earth would you even consider doing it? Well, and sometimes it can just be seen as an additional burden, something that you maybe need to do for the sake of funders or commissioners. But evaluation should be useful to you as well. So not only is it about demonstrating impact, so evaluation enables you to demonstrate the success of your program or the progress you're making. And the information that you collect should allow you to better communicate your program's impact to others. So, which is obviously critical for future funders, commissioners, investors. But it also should enable you to improve your program and implementation. It's important to periodically assess and evaluate your innovation and adapt your activities in order to ensure that what you're delivering is effective. And it can help you identify areas for improvement and ultimately help you realise the goals that you're aiming to achieve much more efficiently. In addition, when you share your results, so your evaluation with others, it can help them learn as well. And extends our broader understanding about your specific innovation or about the context you're working in or the population that you're working with. So there's a number of reasons why evaluation is really important to consider and do on a continual basis. If you want to move on to the next slide.
Sorry, it's doing that thing again. I'm going to stop sharing. So annoying. Sorry, everyone. Just relax. It'll all be fine.
It's always a technical hit.
There we go. Can everyone see that? Because I think if I don't do it in slideshow, it seems to work better.
Yeah, that's fine. There's not too much detail in my slides, so hopefully it's easy to see. But essentially, there are three types of evaluation. There's outcome evaluations, process evaluations, and economic evaluations. So an outcomes evaluation is really measuring the extent to which your enterprise or your innovation is achieving its intended outcomes. So these could be short or medium-term outcomes or possibly longer-term impacts on the system or individuals. This is the does it work question. Whereas a process evaluation is a how does it work or not work. So it may be that you've done an outcomes evaluation and it's not generating the results that you hope for. A process evaluation will help you understand why that might be. So it spans implementation, so the structures, the resources, the mechanisms through which delivery of your innovation is achieved, the consistency with which implementation happens as you planned it to be. So is it being delivered as you wanted it to be delivered? And any alterations that you've had to make in order for it to better fit within the context that you're delivering it in. And is it reaching the people you hoped it would? There's little point in developing an innovation if it never really reaches the end users that you hoped it would. It also allows you to explore the mechanisms of impact, so the mechanisms through which the intervention produced its intended or possibly unintended effects, and gives you an understanding of context, so the factors outside of your intervention which may influence the way in which your innovation or enterprise is implemented, or whether its mechanisms of impact are acting as intended within the context. So is it that there's something within the context which is affecting the way in which your innovation is being implemented? So process evaluations are complementary to outcome evaluations. They're not a substitute. They should be done alongside an outcomes evaluation, ideally. And thirdly, an economic evaluation. So that might be the way in which you're demonstrating outcomes or impact. But essentially, An economic evaluation can take different forms, but it's about assessing the cost of delivering your innovation relative to the outcomes you're hoping to achieve. So how much bang for your buck are you getting for delivering your enterprise or innovation? And sometimes you then can compare that with with usual care or standard care, to give you a sense of whether it's more cost effective. So there's two columns on the outside of this to highlight the formative and summative evaluations. And essentially a formative evaluation, any of these three types of evaluation can be a formative or summative evaluation. A formative evaluation essentially are conducted during the program development, during the development and implementation of your innovation, and are useful if you want direction on how best to achieve your goals or improve your program content or the way in which it's delivered. Whereas a summative evaluation tends to be undertaken right at the end, and it's about assessing how it will tell you to what extent your enterprise or innovation is achieving its goals. What we're not going to delve into deeply today is the types of data that you might collect, and they can obviously be wide-ranging. It could be that in any of these three types of evaluation, you may be collecting hard quantitative outcomes like healthcare usage or clinical variables. It could be self-report questionnaires. It could be interviews that you conduct with clients, patients, staff. It could be observational data. It could be documentary analysis. It could be people's engagement with your programs. So that could be quantitative again. So there are a range of different types of data, and that type of data will depend on what the outcomes are that you're hoping to achieve. If you want to move on to the next slide. So this is a very high-level overview of the three main phases to an evaluation. And we're going to be talking today a lot more about logic modelling, because the first phase in undertaking any type of evaluation is understanding your innovation or your intervention. Now, that might seem really obvious, but starting with the logic model is really important. So, which is in a logic model essentially a diagram representing your intervention, and it describes the problem that you're trying to address, the goal that you're ultimately trying to achieve, and it specifies the outcomes that you want to change or expect to change as a result of implementing your innovation. And it's important to consider outcomes in relation to a range of stakeholders. But the most important part of a logic model is actually identifying the content of your intervention and ensuring that content links directly to the outcomes that you want to achieve, and specifying how it's going to be implemented. So it's what we call the activities within your innovation. And I'm going to show you a template logic model that we use within the network, within the AHSN. Part of that initial stage is also establishing the boundaries. So what resources do you have to undertake the evaluation? Do you have in-house skills? Are you going to need to seek skills from elsewhere? Do you have the time and money needed? Because the size and the scope of your evaluation will be limited by those factors. Phase 2 is about planning your evaluation, so developing research questions and an evaluation framework which will detail the measures that you're interested in collecting, where you're going to get that data from, how often, and by what methods. And then the final phase is implementation, so collecting the data, analysing it, and reporting the results. But throughout those stages, there's a cycle of improvement in terms of developing your innovation and the way in which it's implemented. So by undertaking a logic model, by developing a logic model, this should also enable you to improve the way the innovation is implemented, and the data that you collect and the way in which you analyse that will also feed into that process. So this is a cycle of improvement as you go through the evaluation stages. We can move on to the next slide. So this is, sorry? I was
just going to say, I'll try and make that bigger because it's easy to see. There you go. It's working now.
So this is a draft logic model for a project that we're working on at the moment. And this gives you, and we can actually probably provide you all with a template of this, so it's something you can use if you think it might be useful. It just allows you to document clearly your logic model in relation to your innovation. So as I said earlier, it's about specifying, really important part of this process is specifying the problem that you're actually trying to address and ensuring there is an evidence base to that problem. So does it actually exist in practice, and is it something that people, the relevant people, think is an important problem? And specifying the goal, so what are you ultimately hoping to achieve? And then specifying the outcomes. So on the right-hand side, that might be outcomes in relation to patients, staff, the system, and ultimately the impact you're hoping to achieve. But the important part of this, as I said earlier, is the activities. It's specifying exactly what activities are required to implement the innovation and the active ingredients within the innovation which are allow you to change the outcomes that you're hoping for at the end. I don't know whether you want to move on to the next slide. So I think we're going to move to a breakout task. So yeah, there we go. So what we're going to do is, but I don't know how many groups we have, or how many people we have.
3 groups.
So we have 3 groups. We're going to break out into 3 groups.
Yeah.
And we're just going to talk through, get people to verbalize what the problem is that your innovation or enterprise is hoping to solve and how you're going to achieve that. It's a really good exercise in trying to think about in actually communicating that, which is something you'll need to do to future funders or partners, but also thinking through the logic of what you're hoping to achieve. So I think myself, Sarah and Will are going to be facilitating groups.
And we'll have time to feed back at the end of the session.
Yeah,
so
we'll try and
come back and we can all hear from each other about how this felt.
Fantastic. Okay, well, over to you, Zoe, to set us up into our little groups.
Okay, I'll open the rooms now.
Perfect. So it should come up to you, your breakout room, and just...
Hello, everyone. Oh, hi, James, and we've got Sam.
Hello.
Hi.
Hi, Zoe, John, and Nikki. Oh, and Anthony. Hi, everyone. Can everyone hear me?
Yeah.
So we're just going to maybe do a round of introductions, and then we will, I don't know where everyone's from, what their experiences of evaluation and where you are. Are you the innovator? Are you an academic? I don't know where everyone's from, so it'd be good to know, and then we can work through some of the tasks that we're going to be doing in the breakout sessions. So I don't know if anyone wants to volunteer going first, introductions, or shall I just pick from my top left hand?
Yeah, if you name the names, Hayley, then we'll quickly make the
Yeah, so John, do you want to introduce yourself?
Yeah, I'm in Italy at the moment, if that makes any difference. We've developed a product, a tool which enables basically an NHS health check to be done remotely. We started off, it was a CVD detection tool, but quickly we understood that the opportunity was in augmenting the NHS health check because of COVID-19, nobody wants to do face-to-face. The doctors, nurses, or even the patients don't. So we've actually developed a software tool that enables an NHS health check to be done remotely with a full lab-grade blood test and blood pressure and irregular heartbeat AF detection. Yes, it's completely remote, and the data can be taken by the patient at the end, or it can be transferred. That's it. That's the innovation. And at the moment, we are trialing it.
What's it called, John?
What?
What's it called?
It's called Ticker Test.
Thank you.
I think, yeah, you've been speaking to the HSN already, haven't you? I've heard.
Yeah, yes.
Yeah. Okay. Zoe.
Hi, I'm Zoe. I'm a health coach, and I'm currently working in private practice in Truro. Since COVID, we've been more virtual online, and that's about it at the moment. I'm just sort of building the business, really. So starting at the bottom, working my way up.
Okay. Anthony. Right. Oh, you're on silent.
Right. Yeah. Can you hear me now?
Yep.
Yes.
That's great. Hello, everybody. I'm Tony Felton. I've got a business called Evexia Home, which I run with another individual. We have, I'm a GP by background. We have developed some innovative technology to try and address the issue of loneliness and isolation of people in their own homes and in residential care settings, predominantly the elderly. This is a very hot market and crowded market, many devices, sensors, and other technologies out there. We've taken a rather different approach on this. Instead of trying to measure objective data, we are focusing on subjective data for individuals by engaging with them on a regular basis using technology that's already in their home and changing that very slightly to make sure that in their daily activities they can engage with our technology and answer a very simple question or a couple of very short questions, which over time will build up into useful data that can be used to track three things really: their lifestyle goals and things they want to achieve, their interaction with other people around communication, and their monitoring of their wellness. And this is linked potentially to an online GP service. So if these people get into trouble for some reason, we can evaluate their status through medical services. So the focus is really around supporting elderly people, but it's also very important, final word on this, it's also supporting their relatives and loved ones who often live remotely from the user of this system, and ensuring that they have a daily access to how mum is at that moment in time. And it's based on a statistical model that will demonstrate risk levels. It's a very simple, easy, fairly cheap device. And we think it has tremendous opportunities with regard to potential scale up. In terms of where we've got to in this, we've been working with James and the team at Smartline and have worked our way through the in-residence scheme and are hopefully going into user interface trials with our prototype, which we've already developed and tested in one group of users, but we want to scale that up and hopefully we'll be able to do that in a few months' time. Thanks.
Okay, great. Thanks, Tony. And Nikki?
Hi, I'm Nikki. I'm the manager of the Farming Health Hub. And the Farming Health Hub is there to bring private, public and voluntary sector organisations together to support the farming community across physical, mental and business health. And the farming community traditionally tend not to engage with health and wellbeing services until acute, are still amongst the highest in terms of accidents, how they present in acute care, but also around suicide rates as well. So looking at how we can use a digital toolkit to engage with them. With my other hat on, I'm a social prescriber, community, and looking at community resilience models. But in my past, evaluation is a big part of my background. So I work with PwC and Living Networks from the Eden Project to evaluate a national homelessness project from the service user perspective. and also work with the Charities Evaluation Service and also the Premier League in looking at social return on investment models. So evaluation really important for me from a participant point of view. So everything we're doing at the Farming Health Hub is now starting to look at the ways we do engagement workshops to really understand if what we're producing and what we're doing is actually what people will engage with and use.
That sounds great. Oh, so you're an expert then.
I wouldn't say that. I just have a passion about it because I think I have a passion about it from a service user community perspective in terms of all the systems, products and services we produce, and actually are they what people will engage with to really demonstrate the kind of return on that investment, really.
James, did you want to say something?
Yeah, so James Robury, a knowledge exchange or enterprise engagement person for Smartline Project, essentially. And so we engage with enterprises to support them to grow through digital technologies that impact health and well-being. And essentially, the main request that we get from enterprises is, how do I evaluate what I am doing, essentially, in an evidence-based way that will hold up with credibility to people that I talk to. And so that is our number one request that we have, is how do I might be evaluating already, but is it an evidence-based way, and is it the best way possible using the best evidence-based tools that are out there, essentially. So we formed this workshop. We also do another workshop on evaluation because it's such a hot topic that every enterprise wants to look at. Just wanted to add that in, Hayley.
Okay, thanks, James. So part of this session, well, we've only got 5 minutes left, is about articulating, and I got a sense from some of you what the problem is, but I'm going to just pick on maybe a few of you just to talk through the problem that you're hoping to address by your enterprise or innovation. Zoe, I don't know whether you want to talk a bit more about health coaching and what exactly the problem is that you're trying to address in that context. So, oh, you're on silent.
So in the last few months, I've been looking at sort of narrowing down my niche because the product we were offering was too broad, and we were finding that we weren't hitting customers who wanted to engage, basically. So that's what I'm working on at the moment. I'm looking at previous clients who I've been successful with and creating a program that will suit them rather than just being too broad, because we were hitting loads of different people who basically wanted to circumnavigate the general practice and just come to us for free advice and then go away again, and that wasn't financially very successful for us. So really that's what I've been looking at doing in the last few months, and that's still sort of ongoing.
So is it sorry, go ahead.
I've been using lockdown to sort of get my head down and do that, which is great.
Yeah, I think it's given everyone a bit of a chance to do that. I think.
Yeah.
So is your model that you work directly with GP practices, or?
No, we work independently in the private sector.
Okay.
We have sort of looked at that. I work with my husband, who's also a lifestyle doctor, but since COVID, he's been pulled into other areas. But he's sort of in the background when things settle down again.
So who is your main client? What's your client base?
Generally, an age group between sort of 40 to 60 who are looking to either address hypertension, being overweight, maybe they're pre-diabetic, that sort of thing. So we sort of look at setting goals for people to achieve and small steps, etc., etc., etc. So we sort of work people through about a 3-month program to improve their diet, improve their activity levels, look at connectivity. Yeah.
So I'm just trying to understand. So in terms of, for example, trying to establish the problem that you're trying to address, is it that the clients that you're seeing are not being suitably supported by NHS services? Because there are health coaching within.
Yes. Well, because we're working from a private practice, obviously finances is an issue. So we need to create a product that is going to be driven towards those who are prepared to invest in their lifestyle. And there's a different, I mean, I'm part of the UK Health Coach Association. We were having a discussion about this the other day, and there is a difference between those who are prepared to invest financially and those who don't, and that's a whole other discussion. But that's sort of, we're going down the private route at the moment. As I said, we're very new to this field. Well, no, we're not new to the field, but it's a new venture, should I say. So we're trying things out.
Having engaged with a few lifestyle coaches, lots of their clients that they find problems are that they're chronic patients essentially. They're going to their GP numbers of times and not actually getting any results or getting any better essentially. And so it's an alternative therapy, I guess, to try and solve the complex multiple problems that patient or client may have from a number of avenues, rather than from just a clinical perspective from a GP or something like that. That's where I believe the problem lies. Is that right, Zoe?
Yeah, I mean, I was having discussion with fellow health coaches last week actually, and we were discussing, you know, people who've been in the health coaching game quite a long time, particularly within the NHS, and generally clients who've been funneled towards you because they've been told they need health coaching generally don't succeed. It's those people who have that desire for whatever reason, have made that decision to go and do something about it, are far more likely to succeed. Whereas those people who've been told they need to go and sort out their blood pressure, whatever, generally won't succeed because it's not intrinsic. So we're sort of looking at those, pointing our services towards those people who are ready to make the difference and who are ready to achieve. So they're more likely to get on board and start making those changes, rather than doing it because they've been told by mum or GP or nurse or whatever, because those will be returning customers time and time again.
Oh, we might get pulled back in now, actually, to the main group.
Can I ask one last question before we get pulled in?
Yeah.
Of Zoe, Nikki, Tony and John, the evaluations that you do currently in your business or your enterprise, did you come up with that, or have you sourced extra help to get that essentially? Just a quick answer on that.
Well, James, I'll answer to start with, just to say, as you well know, I sourced Smartline and University of Exeter with your good offices. So absolutely, yeah, that was very, very helpful indeed.
Yeah, so same for me. We found out about Smartline, and yeah, all in the southwest.
Excellent, you're on board, John. Nikki?
Yeah.
Yeah, so I think that's kind of part of working with Smartline, because Farming Health Hub is in its very early days, to be able to then to connect into the kind of forward thinking practice that's happening.
Hi all, I think we're all back now.
I think we're back. I think we'd almost finished. Poor old Terry got cut off in his very last.
There's always a brutal cut off. It's awful, isn't it? I feel so bad.
We sped up. We got quicker as we, it was like there was a lot to get through.
Yeah. But
It's really, yeah, and it's really great once you start having these conversations about the problem statements. It's really helpful for me to hear from everybody.
It gets a bit of a flavour as well in terms of where people are in grappling with evaluation. And
yeah,
I think if you want to feedback quickly, Hayley.
Yeah, I was just going to share my slide. Let's see if I can.
So should we feedback whilst you're getting your slides ready for your section?
Yeah, so this is the feedback. What we wanted you to have a think about is how did you find it? So if you just put it in the chat on a scale of 1 to 5, where 1 is hard and 5 is easy. Put your answer in the chat. How did you find that? To do that, I know there were various different experiences in our team.
Yeah, we probably didn't do it in the total same way, but we gave an opportunity for people to tell us what their problem was. So
Hayley, can you have a look in the chat, because I'm showing my screen, I can't see the chat. Can you let me know?
Yeah, 4, 5, 5 some people not so sure twos.
So I'm just wondering if somebody who found it particularly hard, could anybody volunteer as to why you found, what was it you found difficult about doing that? What made it hard?
Adam, I'm going to pick you out because you've said 2, so I don't know where you are. Sorry to put you on the spot.
Yeah, I just it's something I've been wrestling with in the past as well. But I think that the whole point about the logic model and understanding the very first question, if you're not really clear about that, which is however much you think about it, it's not through lack of thinking about it. But if you can't get clear about that, the evaluation gets very complicated.
Everything is.
Yeah, definitely.
And I don't know why it's so hard to get the first step right, but that's what I found hard about it. But that's also what's good about the challenge, I think.
And what about anybody found it easy? Anybody find it easy and know why that is?
Nick, Jan, you both found it quite easy.
Jan, yeah, you're quite developed, aren't you, Jan, with your work in our conversation?
Yeah, it's a question of having to be, really, because we've got commissions from the NHS, and the NHS loves its staff, you know. But because my background, I was saying, is in another life, was doing independent research for the Department of Health and the Home Office. It's actually, you know, it's something that I do. And also I've been over to you guys in Exeter, and we've done a bit of logic modelling as well about a year or so ago. So yeah, so it was all a bit of a refresh of the old information. I think logic model, I've heard that before. Where's that?
It's definitely a particular way of thinking, and I mean we use it a lot. As I was saying in our group, we use it with all sorts of different people, and the thing that's good about it is that not only that it helps you to see things in that way, but also it's when you do it with each other. So doing logic models with loads of stakeholders and with groups around a project is a really fantastic way of getting people engaged and helping people to understand what it is they're doing and why they're doing each of the different elements of it. So it is, once you get it into the habit of it, it's easier for it to be, you just think about it in a different way.
It's a way of thinking, isn't it, as much as it is a...
So this, the last one was about what did you learn from listening to each other? One thing, can I just add there before if anybody else got any feedback on this, but I was hearing multiple layers to problems, and you realise how difficult that can end up being. You can start on one thing, there's a problem, that this is the problem, but then it sort of whole thing can grow exponentially. So there's something about that, the difficulty around really defining what the problem and what your solution, how it fits together. So I was hearing like multiple layers. I don't know if anybody else was hearing.
Yeah, I would agree with that. It's partly experience of working with a number of different organisations and defining their problems. They can be overwhelmed by them and get too close. They're within the bubble, so to speak, of their world, rather. And it's much easier for someone like myself to be far more objective and say, okay, and break the problem down and say, these are the interdependencies and things that you need to work with, or do something about, or look for additional solutions. People are very good at defining the issue, not very good at thinking of a logical way of dealing with it, or necessarily having a background to be able to tackle the problem effectively.
Yeah, no, I'd agree. It's very, and the closer you are, as you say, the closer you are to something, the harder it is to really define it and to have that level of objectivity, which allows you to sort of define things in a clearer way. So yeah, definitely agree with that, Nick. Thank you.
Can I add something?
Yeah,
I've been working with Ex-Uni for about 10 years now, and like my biggest challenge is communicating. So as an entrepreneur, I'm passionate about what I do, and the passion often gets in the way of the clarity in communicating.
Yeah.
But actually doing it with other people and hearing it, it's so easy to, as you say, be objective and see somebody else's logic model because you're not caught up in the emotion and the passion.
Yeah.
But actually the discipline of working through these things, and I haven't got there yet, and I don't have a written down logic model. I can't wait to get to that point. But you know, even the discipline of going through the process, and every time I get a little bit clearer, and that makes it a little bit easier. So it's a process, I think. A bit like the evolution that you showed on the first one. You know, it's just constantly evolving.
Yeah. No, definitely.
Can I just add as well? I think, Nikki, you're right. I think it's also, I mean, ultimately with a lot of these projects and programs, it's a hearts and minds exercise. And I think the hearts comes across with the passion and the narrative and the story in the background. The mind is convinced by the objectives, the measures and the outcomes that you're using to demonstrate that what it is that you think solves the problem does actually solve the problem. So passion is fantastic and passion is crucial, and that kind of gets the heart side of things, but it's the minds where I think the evaluation and the objective measures come in to really support that it isn't just your passion that's driving this view, it's the objective data behind it as well.
And interestingly, in particular, if we're now going to move on to talk about the sort of spread bit of this and the need for different types of learning around spread, and that passion is really the thing that will help the spread to happen. So it's a really interesting balance that you have to get in terms of understanding it in a sort of objective way and being able to measure and assess and all that rest of it, but not that passion will help you describe to others why this is important, why they should get involved. It'll help you really tell your story, which helps with the spread stuff. It also helps you to understand it from a more detailed perspective, which is what you need for the spread. You need to know how it works, but I'm preempting what I'm going to say. So I will move on to the next bit, if that's okay. I'm going to try, so every time I go onto slideshow, basically, it stops after a while, but I will try my best. Okay, right, so we are now going to move from logic models to turkey sandwiches. Some of you, I think quite a lot of you were here for the spread talk last week, but I'm just going to do a speedy spread recap even. And because some of these bits, some of this really relates to the learning that we need for spread. So we need evaluation. There's this part that we've talked about in the first bit, which is about really understanding what it is that you're doing in order to be able to assess, measure, make improvements as you go along, all that kind of thing. The learning that you need for spread is very much in that category of understanding how something works and the detail of what it looks like for different people. And what I talked about last time, if some of you will remember, is the chocolate cake analogy. So I talked about how when you make a chocolate cake, you make a perfect recipe and you make it and it works really well, but then you share your recipe with other people. They use different kitchens, they use different utensils, they involve their horrible children, they use rubbish chocolate, and before you know it, they have made different variations of what you had as your perfect cake. So your perfect cake is in the bottom left. But in the meanwhile, people have taken what you think is the recipe. So this is how you think it works. But actually, in different contexts, it happens in different ways. So that is where that's the spread sort of metaphor. And in fact, it brings us back to this bit here, which is really about having the right questions for the right time. So I think Hayley picked up on this earlier, but your prototype is really about understanding if it works. So that was a bit at the beginning. So when you've made your chocolate cake, when your innovation, how do you know that it works? What happens when you do it in the way that you know how it works? Your pilot is when it works under you put it in a variety of different circumstances. So what you need to know then is, does it work under those different circumstances? You actually also need to know how and what makes it work in those different circumstances, because then that leads us into the spread conversation. In order to really understand how to spread stuff, as we said last week, you can't just assume that what you do in one context is going to work in a different context. What we need to get to the bottom of is what adaptations are needed for different contexts. How can we make this work well for most people? So it's really about understanding the different contexts, the different ways in which your intervention is working in those different contexts. Okay. So going back to Hayley's bit earlier, we've got the does it work, we really want to know the how does it work. Okay, so the more we understand how it works, the more it will give us the information that we need for spread. I also talked about turkey sandwiches, and this links us back to the logic model, because the turkey sandwich is the bit where we say to ourselves, in order to have a turkey sandwich, you need turkey and you need bread. So the turkey is the bit where it is your solution. The turkey is the bit which is the thing that you want to spread. It's the thing that you know will make a difference. And your bread is actually the bit about it's almost why you're doing this. So we talk about the sort of moral obligation. Why are you involved in this in the first place? And in fact, the bread is in that way is also your problem. So when we talk, one of the ways we do the turkey sandwich exercise, and I apologize to those who weren't here last time because this might sound like gobbledygook, but I think most of you were. When we do a turkey sandwich exercise for people, we do start by getting them to do that really clear definition of the problem and solution, because it allows you to get to the bottom of what your intervention is, which then allows you to understand what it is you need to know in order to spread that further. So this is, again, I'm going to build on different types of learning for spread, and so it links us back to the key spread messages. So the key spread messages that we talked about last time, the things that you really need to do, are you really need to understand your intentions and your key ingredients. So that's, again, that's the turkey bit, that's the solution. So what it is, why are you doing this? What is it that's really the thing that's going to make a difference? Then you really need to understand the context you're going to be working with, who the people are, how they work, what's good for them, what doesn't work for them. I think if you remember from last time, I think the conversation was very much around changing the question from how can I get these people to do what I want them to do, so take on my innovation, adopt my approach, etc., to how can I help them to do what they want to do. And so to shift that question, in order to help people to do what will be good for them using your approach, there's a need to really understand what it is that they need. How do they work? Where are their problems? How they work? What would help make their lives better? The third bit we talked about was setting a clear and compelling aim. So this very much links to the whole logic modelling kind of thing. We really need a quantifiable aim of where you're going with this. So if you're going to spread something, what are you doing with it? You're not just going to spread it randomly. There has to be a clear idea of how many places you're going to go to, what their area is, why you're doing it, so that you then really have something to work towards. And the last bit was about identifying suitable methods to work with people. So we introduced the different range of ideas of different spread methods that you might want to use. And for each of these key spread messages, basically, there's different elements of learning. And I just started thinking about this recently, but there are different methods that you could use that would help you get to learn what it is you need to know for each of those stages in spread. So the first one is really understanding your intentions and your key ingredients. So the learning you need for those, what is the problem I'm trying to solve? What is my solution? What are the adaptable elements of my solution? Because the more adaptable elements you have, the easier it is for people to adopt your idea. And how does it meet the problem? So really, that's taking us really back to that logic modelling bit. One of the things, talking about the adaptable elements, one of the things we put in there, we do the activities, and then we also talk about assumptions when we're doing logic modelling. So what are we assuming is the case? So really getting to the bottom of understanding all of that, what is really helpful for spread. And methods, we talk about logic models, theories of change, very similar, often slightly more extensive, and sometimes the other way around, which is confusing. And doing really in-depth problem analysis. We do quite a lot of work with sort of the problem of problems, because I think, as we discovered here, it's very difficult to define a problem. And often our problem ends up being the absence of whatever our solution is. So really spending time doing proper problem analysis. The next bit is about really understanding the context you're going to work with. So a lot of us, that kind of work it can be quite intensive. We need to know who the people are I want to work with, how do they work, what are their main problems, things like how do they best communicate, really understanding how to engage with people, what wouldn't work for them, what are people really, what's going to really make it work, how can I really work with these people. So there's tons of different ways of doing that. I mean, basic stakeholder analysis allows you to understand who your groups are, where their influences are. There's network analysis, mapping communication pathways and sort of different types of pathways, so clinical pathways, if you're working in a clinical setting, for example. Focus groups and interviews will help you understand that. Ethnographic work, that's probably going a bit too far and in depth, but for some that would be, to really get to understand who it is you're working with and the setting within which you want to spread. It's an amazing way of doing it. And using secondary data, there's a lot of information out there already about different settings that might be able to help you. In terms of setting a clear and compelling aim, that's a whole process in itself, and you need to know about what you want to achieve. You need to know what's reasonable within the time frame. You need to understand where you're coming from. So what's the current benchmark? Where are we already up to? If we're going to set a quantifiable aim, then what's your starting point? So we also need to understand, we talk about the compelling bit of an aim. Why would this be of interest to others? How will this make a difference? Again, logic modelling will help you do that. We seem to be selling logic models a lot today. There's something in there about really understanding existing data. So there's a data review, data analysis process. And then that thing about ongoing monitoring and evaluation, which also links to the next one, so that you're always checking in to see where you are against your aim. And finding ways of using data in a useful way so that it keeps you on track, so that you're always looking back at where you are. And lastly, the thing about the message about identifying most suitable methods to work with people. So I don't know if you remember what we did. We talked about raising awareness, and then we talked about building will, and then we talked about adoption. So there were various methods that were talked about last time. So there's a difference between raising awareness, someone knowing about your thing, and then them having the will to want to be able to do it, and then them adopting it into their system. And there are various different methods, and those methods change depending on where you are in your spread journey. So an important bit here is about always factoring in rapid feedback loops. So Hayley mentioned earlier about sort of how evaluation learning helps with improvement, and this is the same thing. Just not seeing learning as being something you do at one point, or evaluation being something you do at one point, but being aware of how are you going to keep track of whether these things are working or not. Is this approach working? At what point am I going to assess if it is working or if it isn't working, and how am I then going to make a decision to move on to my next approach, my next spread method? So those are just some of the things. I think there are certain questions you need to ask and methods you need to use, which link us back into those spread approaches. And finally, I just wanted to share this with you, and I think we can, I think you'll get all the slides, but this is something that people often find very useful, and something I developed for use in the HSM with our spread projects. The idea being that when you're trying to do spread, there are key questions that help you move along the spread sort of journey, as it were. And we talk about the different stages of spread, and this is another way of looking at it, really. So at the early stages, we're talking about knowledge to interest. So it's not enough for people to know about your thing. They also need to be interested in it. So there's a whole load of questions in here in this table, which we've sort of tried these out a number of times, but trying to get the answers to these questions really help you when you're doing your spread, because they help you move along the journey. So that first bit is really about understanding your context and how you can work with them. The next bit, interest into decision. Again, it's not enough for someone just to be interested. That doesn't necessarily mean they're going to make a decision to use whatever it is or engage in whatever it is you've got to offer. So again, that's about how can we co-create an approach to help people to do what they want to do? What do they know about it? How are they responding to it? What enthusiasms are there? And how can we work with that? What barriers are there? And what can we do about those? The next bit, decision into implementation. I think from an NHS perspective, somebody making a decision to do something doesn't necessarily mean it's going to happen. It's not necessarily going to be implemented. So what are the best ways that we can help them at that point? How can you help people make a decision and then actually put your intervention into practice, actually engage with it and make it happen? And finally, implementation into adoption. So there's a difference between implementation and adoption in spread talk, because implementation is about something happening and it could just happen once. Adoption is when it becomes part of a system and really becomes part of something going forward. So there's a whole load of information there about understanding the data, really understanding, being able to feed back what it is that the intervention has been doing within a setting in order to enable people to take it on further and it be adopted more widely within the system. Again, there's something there about barriers, about telling the stories about why it's worked. So the whole way through, there are different bits of learning that you need to be thinking about in order to help you on that spread journey. And I'm once again aware that we've just chucked a whole load of stuff at you, which I'm hoping is a good introduction, and we can go into these in more depth at some other time. But I think my time is probably up now. But yeah, as I say, it's linking, it's that whole thing about not saying evaluation and learning is something static, but it's being something about making sure you've got the right information at different stages to be able to keep yourself moving, and seeing yourself and your approaches to your work as being based in this understanding of what learning is useful at which points.
Thank you so much, Sarah. And I think particularly if you're really serious about scaling and growing, that learning evaluation, just as you say, has to be part of your practice. You know, building it into how you do it, and some really good points that resonate there. We have a minute or two. If people have any quick fire questions, the slides will be shared. Obviously, the recording of this will be shared too. And obviously our details will be available for you to contact us if you have burning questions that you wanted to ask here. But is there one or two questions that people want to sort of throw in? Tammy's asked about the access to slides, absolutely, and the recording. So we'll get that after this session for you to munch through. Can I ask a question? Yes, go for it.
Sorry, I'm not sure I should do it through chat or through the virtual face-to-face.
Yes, no, I wasn't specific this way. So
I'm missing human interaction, so this is
no, please, I am too.
So one of the things, I mean, William and Sarah and Hayley, you've obviously been involved in the work Camille and I have been doing.
Oh, Terry, yeah, fabulous, yeah.
And one of the kind of feelings that we're getting, and how you would overcome this at the AHM is when you're working with a team who are developing a prototype and a pilot and implementing that within the NHS. How do you then kind of continue with I don't want to use the word motivating them, because it's exhausting kind of making it work and setting something up from scratch, especially when it's very innovative anyway. So then when you get into a point of going, well, you've done loads and loads of hard work, what we really want you to work on doing now is spreading it. And everybody's like, oh God, oh my God, really? We've just gone through all of this within our local area, and it's really challenging. How on earth do we then start kind of dissecting it to identify our key ingredients, if you like, for others to
there's probably another session we can do just on that very area, I think. Terry, did you have
there's two bits. There's something about that motivation to do spread does need to be there to a certain extent, and we talk quite a lot about helping people to understand the value of it. So is there something that you can do to really engage people in the idea of spreading it based on stories and experiences of what has worked well in different settings, and really getting people engaged in that? Keeping it simple, I think, is sounds like it's something you might need to be focusing on, because as you say, people have worked really, really hard, and if the next bit is to do another load of work in order for it to be spread somewhere else, keeping that transition bit as simple as possible, and using what you've already got. So we talked a lot there about additional learning that you might need to gather, but you've probably got a whole load of stuff that you already know, that the team have already experienced, which can be used without having to do any extra work. That's what I suggest. But I do think.
Well, what we certainly found is that as we're starting to drive awareness and communicate what it is that we're doing with the wider world, naturally people are coming into us and going, oh, this is really interesting. How does it work? And we could sort of see how we might adapt this for our service, and how did you make that work and that work? So what we found is that naturally people's enthusiasm and passion external to the project is going, well, we can really see this working in our area. How do you go about doing it? Can you share some of your resources? Would you come and talk to us about it? Can you share some knowledge and so on? So it's kind of, it sort of takes you away, I guess, to an extent from getting, we're still implementing the project and
getting on with it.
Still getting on with it.
Not, we don't know. And there's part of us almost reluctant to start, in inverted commas, spreading until we've got a definitive summative evaluation.
Well, let's pick that up. I hate to cut you short, Terry, because we're right at the end of the session now. But we've got a session to catch up soon, aren't we, Terry and team? And I think
that conversation
with you specifically. And a huge thank you to everybody. Huge thank you to Sarah and Hayley for sharing some insights on learning for spread. Hopefully, it's just a taster, just an intro. There is a few links we can share as well. A great toolkit that Sarah also produced in a previous life, in a previous program, that we can share as well. And so hopefully you'll join us next week, where we're going to look at navigating the NHS and social care for those that are looking to get commissioned within that space. And we'll be joined by my colleague Stuart Monk to talk about that, as well as Sarah and some of the team. So Sarah,
James has got his hand up.
James, do you want to say a few last?
Just as a last point, so this was an introduction session for evaluation and spread, and essentially the idea is to do another longer workshop to work with people on your personal or enterprise evaluation. So we give a lot more time to it, essentially. So if you've got any ideas of how you want that to play out, please feed them in. Thanks, Will and team.
Please do. Thank you. And thanks, James and Emma, and hope you have a great rest of the week, everybody, and see you soon.
Bye.